Hi, I'm Dr. Greg Hamlin, and I want to talk for a moment about the definition of clinical depression. A lot of times you'll hear people say that they were sad or something happened to them and they go, "I was so depressed." And what they really mean is they felt sad or they felt upset, and it was a passing feeling. Now, when we talk about clinical depression, that's very different. It's not at all like sadness, except that the feelings are similar, but they persist for a long time. Now, if you think about people you know and you think about yourself, you can probably think about a typical mood that each person that you know has, and that a typical mood that you have. Think of that as your baseline mood, and each time you go through an experience, you feel what's appropriate to that experience. If it's happy, you feel happy. If it's a good time, if it's funny, you laugh. If you have a big disappointment, you will feel sad. But these feelings don't last that long, and eventually these elastic emotions come back to that typical mood, to that baseline. And so it's just like we all have a set point for our normal mood, whatever that is, kind of our average mood. And so we can feel very sad for days and days, and that's not clinical depression. Why? Because when we try to work ourselves out of it, we try to do things to cope, we find that it works. We get out of it. Now, what clinical depression is when the set point for the brain changes. It's when the typical mood becomes dark and sad and a feeling of lifelessness, a feeling like you can't enjoy things that you used to be able to enjoy, the lack of pleasure in things. And even though you may have a great day, or you may go to a birthday party or hang out with friends and laugh and have a good time, what happens when you're clinically depressed is that your mood keeps going back to that set point, that lower set point, and it's as if this giant swamp monster reaches its tentacles out of the swamp and pulls you back into the swamp of depression. And so people get confused because they think, well, I had a good day yesterday, I was happy, felt good, and they think I couldn't be clinically depressed if I had those feelings. But really that's not the issue. The issue is whether that set point has changed. And so what people find is they just have to work harder and harder to have their mood stay up, and that gets frustrating because the efforts they make don't work, and they keep going back down to that low, dark mood. And so the next time you hear the term clinical depression, I hope you'll have a better idea of what it means.